Hi, my name is Kevin Ju, and I'm a spine surgeon at Texas Back Institute. Today, let me talk to you a little bit about cervical disc herniations, or simply just a herniated disc in your neck. So the cervical spine is the top part of our spine, and it's basically our neck. It goes from the base of our skull to about our shoulders. And in between the bones in our spine, we have this flexible disc material, and it allows movement. It acts as a shock absorber. The disc has a tough fibrous ring on the outside, which contains the softer gel-like material on the inside called the nucleus pulposus. And so sometimes with trauma or even just wear and tear over the years, the tough outer ring, which is also called the annulus fibrosus, that can get a tear in it, or it can just wear down, and that allows that soft gel-like material on the inside to leak out. When it leaks out, sometimes it can push on your spinal cord, sometimes it can push on nerves, and that's when patients can start developing symptoms. People often ask, what symptoms may I feel if I have a cervical disc herniation? And so it really depends on what the disc herniation is touching or compressing or irritating. If the disc herniation is pushing on one of these nerves in our neck, these nerves travel down our arms into our forearms and our hands, and so if that nerve is getting irritated, people can have pain, they can have numbness, tingling, sometimes even weakness if that compression is bad enough. Other times, the disc herniation can actually compress a spinal cord, which runs up and down the center of our spine, and that can lead to pain, numbness, tingling, and weakness, just like nerve compression can, but it can also affect more complex functions like hand dexterity, fine motor control, even your balance and your gait. And so when people have spinal cord compression, they can get additional symptoms that can be concerning and cause them to seek treatment. How do we diagnose a disc herniation? So when you come and see us in the office, we start off by taking a good history, we listen to you, we try and figure out what symptoms you're having, when it started, where it is, how bad it is. Then after that, we usually do a good thorough physical exam where we can test your strength, test your sensation, test certain reflexes, and all of this will give us an idea about which nerves might be involved. But in this day and age, usually people will also get an MRI, because an MRI will really show us specifically where the herniation is, how many there are, how big it is, if it's pushing on the spinal cord, if it's pushing on the nerves, if it's pushing on both. So usually through a combination of all the information that we can gather plus imaging, we can come up with a good diagnosis for you. Once you have a good diagnosis and you've been told that you have a cervical disc herniation, what are the options? What can we do? How can we treat this? So fortunately, the vast majority of patients who have a herniated disc in their neck can improve with conservative treatment. They don't necessarily need surgery. So options that we have for treating your symptoms without surgery include physical therapy, where they work on stretching, strengthening, posture, and other modalities. Another option is to take medications such as anti-inflammatories. If physical therapy and medications don't provide you with adequate relief, then another option we have is to do something called an epidural steroid injection. And this is where we use x-rays to precisely get the medicine right where your herniation is. So we can deposit the steroid medicine around the irritated nerve, and that will bring the inflammation down and likely make you feel better. Surgery is typically reserved for instances where either one, we've tried a lot of conservative treatment and it's not getting better, or your symptoms are getting worse. If you have significant weakness, or if you have spinal cord dysfunction, something that is called cervical myelopathy. So those are the three reasons that we typically start talking about a surgery. Now, to do surgery for the cervical spine, there's a lot of ways we can get to the spine, but the two general categories are either coming and approaching the spine from the front or approaching the spine from the back. When we go from the front, our options usually include a disc replacement, which is a great option because we can remove the degenerative disc, we can remove the disc herniation, and we can replace it with a prosthetic disc that still has motion, so you don't lose any of that. The other option that's commonly done for disc herniations is something called an anterior cervical discectomy and fusion. And what that is we also remove the bad disc, we remove the disc herniation, but that surgery allows us to do a lot more bony work. So if you have bone spurs in addition to the disc herniation that's pushing on neurologic structures, if you have deformity, doing the ACDF procedure allows us to correct a lot of deformity and remove a lot of bone and compressive structures without destabilizing the spine, because we're going to do a fusion afterwards. Now, in terms of options coming from the back of the neck, those include either something called a Laminoforaminotomy, and that's where we go in and we remove a little bit of bone around the nerve so that the nerve can be freed up a little bit more. The other option is something called a laminoplasty, and that's a very elegant way to treat spinal cord compression, especially at multiple levels in your neck, without having to do a fusion. So we can free up the spinal cord and still preserve the motion in your neck. And finally, the last option that's commonly done is something called a cervical laminectomy and fusion. Now, this is a more powerful procedure because it allows us to correct deformity in your neck. It allows us to realign the bones, because sometimes people's bones will start to slide. So this procedure, a laminectomy and fusion, will allow us to correct all these things and allow us to decompress the nerves in the spinal cord. But the trade-off is that we do have to put screws and rods to hold the spine in that improved alignment in that new position. But those are generally the options that we have in our tool bag for dealing with cervical disc herniation. Cervical disc herniation might also be called a bulging disc. It might be called a slip disc. Sometimes people refer to it as a ruptured disc, but all of these are referring to the same thing. It's basically when the disc in your neck develops a tear and part of that disc spills out and starts affecting the nerves and is causing symptoms. So if you're experiencing any of these symptoms, or if you just have any concerns and want to see a professional about your spine, feel free to give our office a call. I'd be more than happy to see you, give you a good diagnosis, and take good care of you.